Females have been so dismissed when they do see a physician.
They struggle in silence so often that it's sad.
We all give birth to you, so you better pay attention to our bodies.
3 out of 4 women who seek care for menopausal symptoms are left untreated.
Apparently, rumor has it increases your sex drive off the hooks.
Everyone, welcome to the Hot Flash Health Podcast, where we're dishing out unfiltered truths about menopause with a side of sass and a little sprinkle of sass. Get ready to dive into the wild world of hot flashes, mood swings, and all the other joys of being a queenager. No, this ain't your grandma's podcast. We're here to chat about our bodies, passions, fears, and desires, all while navigating the roller coaster ride of menopause. So grab a glass of wine or 3 and kick back and let's begin this hot wave together. I'm Courtney Mamuscia. Alongside is me, my fabulous co-host, Dawn Fable. We're 2 outspoken gals who aren't afraid to say it like it is. And just because menopause is another chapter in the book of life, we're here to help you all along the way. Now let's kick off today's episode. Dawn, why don't you go ahead and introduce today's amazing guest?
Yeah, amazing guest. He should feel great to be surrounded with such amazingly beautiful women like you and I, Court, right?
It's true. You're welcome to be here.
Thank you so much. So we have the pleasure today of introducing Dr. Oswaldo Grenardo. He is the new medical director at Hot Flash Health, most exciting, but has a very prestigious track record in his education and what he's done in the medical industry. He is a graduate of Stanford University. Also noted played football at Stanford, which is something he does not speak about, but something we found out. Ozzy went on to then obtain his medical degree here in Boulder, Colorado at the University of Colorado, and then went on to practice his family medicine, got his master's in business administration, healthcare administration, and most recently served as the Chief Medical Officer and Chief Diversity Officer at Common Spirit. Ozzy is a wealth of knowledge. He's a super handsome guy. Sadly, ladies, no, not single. And he's crazy enough to join us on this incredible mission around Hot Flash Health. Side note, one of the things that really attracted us to Ozzy is very, very passionate about bridging the gap between underserved communities and healthcare. So welcome, Ozzy. We're so pleased to have you. And I have to ask, first question, what in the hell got into you for aligning yourselves with 2 crazy women like Courtney and I, and an amazing concept and vision that we have around Hot Flash Health?
Well, it really started with so many of my friends. So I'm 51, and so many of my friends are going through this stage of life. And to better understand them, to better work with them and figure out how I can be a better friend, a better colleague, there was nothing better than to start learning more about menopause and the issues that they struggle with. They struggle in silence so often that it's sad. And so for them to have hot flashes, any number of different changes that people get when they have menopause, that then became something, a driving force for me to actually learn more and then get involved. And when this opportunity came up to work with you both, certainly it was an easy choice to say, yeah, this is an area of medicine that is sorely neglected, one in which we need to do a lot more research and have a lot more attention drawn towards, because this issue certainly is one that is not addressed as well as it could be. So it was a wonderful opportunity to start addressing that. It's my honor.
Nor is it going away, by the way. We're all going to go through it, unfortunately, as women. So that's why we're here to talk about it. Mm-hmm. Some of the things that we've been hearing with, doctors that we've been talking to and just reading things is really the lack of education, like what you mentioned, for doctors out there. So can you kind of talk a little bit about how the fragmentation of our healthcare system impacts women's health and, particularly during menopause, and what, how you hope to change that?
Yeah, that fragmentation is crazy. So there's about I think the last number I saw was 75 million women in the US who are in perimenopause, menopause, or postmenopausal. And so then when we look at, are they getting care? They're not. There was a study out that showed about 3 out of 4 women who seek care for menopausal symptoms are left untreated. So that is terrible. So when we look at where are our resources being diverted to, what are we doing for women? And when they come in and start talking to us about these issues, why are those issues not being addressed? So these are people who are actually women who are going to see the doctor and then not getting their symptoms or underlying issues addressed. That stems from any number of different reasons. When we look at how the system, the medical system, and the institutions of medicine are set up, it's pretty male focused. And so just now are we coming to a point where there's a lot more attention, a lot more research on this, but we're so far behind that even our residents, our OBGYN residents, there's a study in 2023 that showed, gosh, I think a less than a third of OBGYN residents were prepared coming out of residency to talk to patients about menopause. So OBGYN residents being trained to help women aren't prepared, a third of them, to talk about menopause. So where do they get that information? How do they make it up later on in their career? That's tough. So they're already at a disadvantage. Women are at a disadvantage by going to see people who are just coming out of residency, who may not have the understanding or education around it. So that system is set up really for, not for women in menopause. The research is not there. Research has not been prioritized. And so there's some things that are happening which are exciting around moving towards that, but it'll be nice to actually see monies diverted to dedicated menopause research.
I mean, I think that's shocking that women are still last to be cared for. Like, I've never even heard about that. That's weird.
I mean, it's disgusting.
It is disgusting.
It's
Y'all,
disgusting.
we give birth to you boys, okay? We all give birth to you. So you fuckers better pay attention to our bodies.
I know it's horrible, and it's just a repetitive system where it gets worse. So I think the tides have turned, and so much of it is who is controlling the dollars around research. And if there are more people in Congress, or there are more people dedicated who have funds who want this research, then that certainly helps push people to then, at the federal level, having those funds qualify for research around this, as well then as other institutions really taking up this cause.
I can't wait for Hot Flash to blow up more, because then we'll give money to help research.
Totally.
Mark our words. Mark our words.
Yep. You got that noted. And that's a huge piece of Hot Flash Health, is we not only want to increase education and awareness around this really important topic that's been ignored for so long, and that females have been so dismissed when they do see a physician regarding any symptom that they might have for menopause. So Ozzy, first and foremost, thank you for, being a male physician and standing up for this important cause. I know you are a father to a beautiful daughter who I've had the pleasure in meeting, Liv, and you are paving such an important path for future generations to really get the care that they deserve around this topic, and prevent some of the stigmatization and feelings that women are having to suppress because they're embarrassed to discuss them, or physicians don't have the education or tools or resources to address them. So they're just being dismissed out of a physician's office. So thank you. And we feel so fortunate to have you.
Oh, well, you guys and the passion that you bring around this issue is fantastic. And hopefully the word gets out, and hopefully more people are then feeling comfortable about having these discussions with their docs. The problem is, so I'm a male primary care doc. I'll speak for myself, but likely for most of the male docs, primary care docs, I'm an idiot when it comes to this. And so having having now learned more about it, I used to just say, if you've got any symptoms like this, I got to send you to your OBGYN. I can't listen. I can listen to you, but I have limited tools to help. And that's not correct. So through this process, it's actually helped me get better in terms of what can I actually do for patients who are in menopause or perimenopause, and how can I really treat their symptoms? Because there are a few go-tos that I'd have, but not be able to do the full gamut.
Yeah.
So moving towards that is going to be important, and then getting people to the right docs. If you're a female, so we know, so when we talk about underserved populations or healthcare disparities, when we know that people who see physicians or providers who are the same as them, whether or not it's from a gender perspective or race perspective, we know that their care and outcomes improve. So just that commonality, just the trust, that really goes a long ways towards actual outcomes and improving them. So we know that, if you're looking for if you're looking for a doc to help you with perimenopausal symptoms, you've got a male physician, you should think twice about, can you trust this person? Are they going to get you to where you need to? Or is there someone who can that person help you right then and there? So hopefully they can. But there are some docs, male, female, who can't. And so it's really trying to figure out who you connect with and how you can get the care that you need.
Yeah, thank you. And Ozzy, one of the reasons that we were so attracted to you as a physician and a potential medical director for Hot Flash Health is really your passion around inclusivity, diversity, and the inconsistencies that you're seeing in care, in inclusion in healthcare. I this morning read some mind-boggling statistics. 46% of women of color lack information about menopause. That is in comparison to 31% of white women. 50% of Black women and 44% of Hispanic women believe that their menopause symptoms are not taken seriously. That's in comparison to the already 29% of white women that are feeling the same way. And Black women are experiencing hot flashes for an average of 10 years versus 7 years for white women. Then, of course, you add all of the mental disparities with higher rates of depression, anxiety, mental health issues that come along with menopause. I can only imagine some of these underserved communities, how they are feeling dismissed. What has led you to be so passionate and have such a loud voice around this issue? And what can we do to help support some of those underserved communities and increase education and awareness around these really sad statistics?
Yeah, so those numbers you read off, horrible, absolutely horrible. And we see those numbers present or prevalent across almost all outcomes that we have. So whether or not we look at diabetes or heart attacks or kidney issues or osteoporosis, every single outcome we have almost always shows that Black women and or Latina women have worse outcomes. So as we start to think about how to address it, it's who's giving the message. Is there a trusted person that people are getting the message to um, from their community? Are they hearing it or seeing it from their elders? Because that's a great way to actually get that communication around some of these issues to them. Do they have access to healthcare? If they go in and see a doc, are they going to be dismissed or not? We have lots of data around women of color who don't have the same type of care, don't get the same type of care with similar symptoms when they go into a doctor. And so as we start to look at some of these things, some of it is physician training or provider training. And can we start to better recognize and understand what our biases are so that we can better help people who are different than us? Because we don't have the same number of Black or Latina providers in the community. So if we don't have those providers where we know that if they're race concordant the same or gender concordant the same, that they're going to get likely better outcomes from their care, then we've got to figure out how do we help all the other providers get up to speed and really recognize what we need to do to help. So that's just on a provider-patient relationship. So we've got a lot of work to do in terms of communication, in terms of education and understanding, just to get to the point where someone can take in the information and then make an informed decision. So there's so much backlog that we have to do to get to that point that we just lose time, and people then have, again, worse outcomes when it comes to a lot of these symptoms.
So not only are women being ignored in general, but then it increases exponentially if in fact you are an underserved community like a Hispanic or a Black woman or whatever. That is absolutely so wrong.
Yeah. That's the way our system is set up. The biases that we have, just from an unconscious bias standpoint, when we look at, we've seen cardiology studies where people who have the same exact symptoms come into a doc, and the only difference is their skin color. Some get treated. The Black people who have gone in get less care or less aggressive, appropriate care than their white patient counterparts. And so when we see that happening, and we know doctors aren't racist, we would hope not. We would hope that your doctor is going to be able to treat you in any way that they can to the best of their ability. But we know these biases exist because we're seeing them borne out in some of this research. So when that happens, there's so many things that we got to then do to address, just to get to the point where a patient can get the information that they need.
I think it's interesting as a doctor, your whole ethos is to help people, right? To find a solution, to figure out how to treat people. And I feel like you've mentioned a lot of these symptoms if you're talking about cardiovascular disease or osteoporosis, and looking not only in underserved women, which, mind-boggling at this time and age in our world, but just what are some of the implications of lack of understanding, where if people understood how menopause might impact health moving forward, do you think if we address some of these symptoms earlier, it would positively impact some of the outcomes where people would not be getting such hard post symptoms? We'll put it that way.
Yeah.
In medical terms, you can answer that.
Yeah. So I think first it's, do people know what menopause is? Do people know what perimenopause is? Do women who are in that age range know what some of their symptoms are and how to address it? Has someone talked to them about it? There's information, business information around, or business data around, when women have menopausal symptoms and they have to leave work, or their work productivity goes down because they're dealing with their symptoms that haven't been addressed, that I think the cost, I thought I saw something that said it's around $3 billion in the US a year around not actually addressing it appropriately. So when we look at, so that's just a financial business perspective. That's not even a health perspective of looking at how, if you don't address it soon enough, how does that affect you and your relationships? How does it affect you and your family? How does it affect you on your job? So the more that we can get people to know and understand, like this podcast is trying to do, around what is menopause, and what are the symptoms, how can you treat it, what can you do for it, who do you go to see, the better we get up front with some of this work, then the better off we'll be on the back end with health outcomes as well. Then that's all from a physical standpoint as well as a mental health standpoint, which is incredibly important in this day and age. So as we start to look at mental health issues, if you can't handle or you're not addressing your physical symptoms, that seeps into how you're feeling about yourself, how you're feeling about caring for your friends, your family, or just who you are, then that plays an incredible toll psychologically on someone. And that's what we've got to get a good foundation from a provider standpoint, is how can we help people really do the things they need to do to be the best they can be going through these symptoms.
I'm wondering if there has been some research lately where hormone replacement therapy is actually helping, because it kind of combats this really, quick change of hormones where it does show some positive impact moving forward because you're not so wonky for a couple of years and like you're kind of more regulated, so you're not getting things in post-menopause era.
Yeah.
I don't know.
So it's so funny you say that. So there was a study. So I just saw this today. There was a study that came out in JAMA, Journal of American Medical Association, and it was in May, that said any woman below the age of 60, they found that hormone therapy has a low risk of having adverse events. So the problem that we ran into as in the medical community was that prior to this, we had it was right when I was in residency, and there was a study that came out that showed women who were in menopause, or excuse me, women who were on hormone replacement therapy had a higher risk of breast cancer by using it.
Mm-hmm.
And so then people jumped off of using
Right.
hormones and really killed the industry for a long time. And so now that we've got more research that shows, no, you are fine to take it.
Mm-hmm.
And the people who were studied in that were, I think, around an average age of 63 years old. That, yeah, it's not around the people who are 40 years old or 50 years old who are going through these symptoms that the hormones can really help. It's people who were really old during this time frame who had likely a higher risk of breast cancer in the first place.
Yeah.
So now it's come full circle where now they're doing research to say, oh, are there actually issues for people who are younger than 63 taking hormones? And we're finding that there's not. So now there are many OBGYNs who it ran the gamut. I have a friend, she's an OBGYN. She said, forget it. That data was problematic. I'm going to keep you on hormones, or she had all my patients on hormones and they were good with it. There were other docs who said, no, that risk, I worry about the risk. There's not enough data, and took people off hormones. So hopefully I think we're moving back into an era of, let's get people on appropriate hormones so they can treat their symptoms and hopefully feel better about just everyday activities.
Yeah, thank you. Because I think that there's so much misinformation out there about hormone replacement therapy. And there's such a lack of availability or accessibility or education around HRT. You have these outdated studies like the Women's Initiative study that you're referring to, and it's instilled such a tremendous sense of fear in women, right? Where there doesn't need to be that fear. So it's nice to see that menopause is having its moment and physicians are coming full circle, and women are really advocating for themselves to feel better. Obviously there's the power of education, and there is a huge intersection right now, Ozzy, happening with AI and healthcare. And it's really fundamentally changing healthcare in that physicians now have real-time access to data, and there is a power in numbers. Can you chat a little bit as a physician on your thoughts around AI and how it is going to positively and negatively impact that in medicine, or more specifically, women's health?
Yes. So for sure, AI is crazy. So I weirdly get excited because I was a Terminator fan back in the day. I think AI is going to probably lead to some Terminator-like esque future for us. Yes.
I might have been a dork too.
You guys are both dorks. You both surprised me. I wouldn't think of either of you like that, but.
So it's so funny. When I go on AI and I ask ChatGPT something, I always say, hello, ChatGPT. And then I always say, goodbye. Thank you so much. And then I've asked ChatGPT, I say, when you take over the world, will you remember me? Because I was really nice to you. So ChatGPT says, no, you're fine. We're not going to take over the world. That's a whole other story. AI is fantastic because...
Ozzy, is it fair to say you're in a relationship with ChatGPT?
We talk all the time.
It's more interludes.
It's complicated on Facebook.
We said he was taken earlier, ladies, but we didn't tell you by whom.
Oh gosh. So AI is great because then we can get information on multiple studies. What is the best thing going on right now for patients? How can we treat people? There's a new med that just came out this week that was talked about around hot flashes and helping women with symptoms. And so it's not yet ready for market, but there are more that are coming. And so knowing that, not having to search multiple websites to find what the latest research is incredibly helpful. But we've got to recognize that there are some data that goes in that's crap. So from that, we've got to figure out what's the best way for us to incorporate good data or get good data in so that we can get good data out as we're trying to figure out what's going on with menopause or any number of other medical issues for people. So that's the biggest piece is if you have terrible studies that go into this data, then we're going to get terrible outcomes or things that we're not looking for later on. Do we have good information for race, ethnicity, and what is the bias in some of the AI work that's been done so that we can then transfer some of this information to different populations. So those are some of the critiques of AI that I'd have is what is the data in that's going to give us the data out. But overall, good gosh, when AI can detect better in many different circumstances, a woman who has breast cancer by looking at thousands to tens of thousands of mammograms and then being able to say for your mammogram, do we think that this small area is going to develop into cancer? We've got that ability now.
Yeah, so what a gift of technology. You know, there's 5 things that we've really focused on because Hot Flash Health will be incorporating AI into our business model, and there are developments that are happening right now and that we will be launching here soon. So stay tuned for that. But I think, you know, AI is fantastic in terms of predictive analytics, right? Because of the access of all the real-time information. There's detection tracking and symptom trackers. AI can really serve as sort of an educational and support community. And then I think just the mere volume of data and the sentiment that AI is delivering that physicians unfortunately are not. We are at an all-time low of patient satisfaction with what they're experiencing from their physicians. Physicians are not spending time with patients. Physicians are not hearing their patients, or females, particularly around menopause, are not feeling heard. You know, we as women are being dismissed.
Women are. Oh yeah, that was funny. I was like, she said. Oh yeah, all right, you got me.
With that being said, I think that there's so much around AI that, yes, it can be terrifying, but at the same time, the benefits are far outweighing the disadvantages, particularly in medicine. And, you know, again, we as females and patients just in general are feeling very dismissed, and the average patient sentiment is at its all-time low. So that's great news on AI.
That gap of what people can get and how they can get it, it's great with the internet that we could get to a point where you didn't have to get your information from a doc, that you could look up what was going on and have some semblance of where you might want to go with your care or what you're thinking about, and then hopefully talk to a provider. AI is that next level leap where if you don't have that access to a doc or you're being dismissed, that you can then actually say, like with some of the work that you're doing, that we're doing, you can actually say, all right, what is actually going on? And what should I do? And then hopefully work with someone that you trust to get you to the next step.
Yeah. Yeah. Enough about you, Ozzy. Let's talk about me for a minute. So, just kidding. Staying on the AI, how do you feel? And this is something that we're working on. Obviously, we kind of alluded to it and what Don said. But how do you feel AI can be further pushed for personalization, right? So I think a lot of people are nervous about AI stealing brain power and taking over jobs. But we really want to leverage this technology for the best use possible, where you're saying, provide research and looking at statistics and where their blood work might come in. But how can we ensure a level of personalization with AI as a treatment option for people moving forward, especially with menopausal women?
Yeah, so I think using AI to help you with what are your symptoms? What can you do from an over-the-counter perspective? What do your labs look like? What are they telling us? Are they problematic or not? What should we be doing? When should we go see a doctor? I think AI can do a darn good job of that. Oh, we can cuss. A damn good job of that.
You
Yeah.
can.
So
Whoa.
Wow.
sorry about my potty mouth. I think that piece is is fantastic because then you don't have to use someone else to get to the point where you can say, all right, I need help. You can work on things, you can do things, and have a treatment plan that doesn't involve a doc, that doesn't involve prescribed medications, to really help see if that actually helps your symptoms. So that can all be done through the work that you do online and with AI or a company like Hot Flash Health. I think once we get to that point, it's really going to help eliminate the symptoms that a lot of people have by being able to not self-diagnose, well, self-diagnose. So here, I'll tell you, as a primary care doc,
Dr. Google on steroids, right?
Yeah.
yes.
Yeah.
So,
WebMD.
so oh gosh. So when I started in medicine, I had a woman tell me, so this was my first year in practice. She told me what her symptoms were. She said she really knew it was X diagnosis. I said, I don't know about that. And I thought it was this other diagnosis. And so went on this whole roundabout around, oh no, this is the way we should go this way. And it ended up, of course, that she was right. So from that moment on, I never questioned. If a woman knows what's going on with their body, I'm always like, yeah, you tell me what you want to do. You tell me where we're going to go with this.
You are a
Because
smart man. You are a smart man.
you guys are the smartest. Dudes are so dumb. Dudes are so dumb about
You
what's
heard
going on
it
with their body. We are. We're morons. Women know. So when women would have a UTI, oh, you got to come in and blah blah blah. No, it's stupid. Women know when they have a UTI. Give them an antibiotic.
Thank you.
This is not
Thank
rocket
you.
science. So when women go through perimenopause and menopause, and if they have an idea that this is what's going on, I think it's incredibly beneficial to have a system set up where you can get hopefully good information and then get things that you can do at home or by yourself or over the counter to really start to help symptoms. And that will hopefully bridge the gap between the communication issues and or access issues that people have.
Unfortunately, I got a mammogram this week, and unfortunately yesterday I got that scary call of, hey, listen, there's some interesting sort of asymmetry going on with your breast tissue. It looks a little bit different than it did last year. Just to be overly cautious, we'd like for you to come back in and get an ultrasound and make sure everything's okay.
Yeah.
Well, perfect example. Of course, your heart drops because that's never a phone call that you want to get. I think we as human beings are so trained to go to Dr. Google or Chat GPT. But in this case, I use Chat GPT for this sort of thing. And as many of you know, I've been on Ozempic, I've been on the semaglutide, and Chat GPT was able to produce information that there's something called Ozempic boob, right? That is happening in the density and change of tissue around your breast for many people that are on Ozempic. So, of course, being hopeful that that's the case or there's nothing wrong, it provided such a extra level of education and data, and went to go on and say how many people had been studied to have this exact thing. And what a powerful tool that we can use for more information is more power, right? Data is in numbers. And so I was so compelled to share that story because I think that it is so important, and there's so many tools and resources that we can use AI for with the progression of healthcare. Particularly for things like that, where Ozempic and these GLP-1s and GLP-2s are, fairly new medications. So if they can aggregate all of the data and give us that information, what a gift.
Yeah, it's fantastic. So again, with you being able to get that eases your mind, that puts you in a better mood. Think about all the people who don't have that ability to feel comfortable with some type of diagnosis or the direction they're heading with their care, but to have information at your fingertips, it is fantastic. So I'm
Yeah.
glad that you were able to look that up pretty quickly and feel better about what was going on.
Yeah, thank you. Now, switching gears a little bit, also very important developments around Hot Flash Health and lab testing, right? Soon, very exciting news around labs. But Ozzy, I know the first thing for many of us women who are feeling perimenopausal or feeling off are to request a lab makeup from our physician around hormones. How do we as women, because that's not something that's frequently being offered to us, right? It seems like more and more we're having to advocate for that. We're having to push our physician. We're having to go perhaps online. We're having to go more of the functional medicine route to really get a comprehensive panel of hormonal testing. How important is lab testing around this menopausal journey for women? And at what point should we be asking for labs? And of the labs, what markers should we really be asking for and concentrating on?
Yeah, so with labs, it's a fascinating discussion because as women go through perimenopause and menopause, women will have their numbers go up and down or can fluctuate wildly. So for some docs, they say, no, forget it. We shouldn't get any labs. We know you're probably in that age range. You're having some of the symptoms. Let's just call it what it is, and we'll see if you get better. We'll see what things we can do to help. I was always more on the side of, yeah, let's get some labs. Let's see where you're at so we can track. Sometimes the tracking with those fluctuating hormones is problematic or not helpful. But for a lot of people, it gives them certainty around, yeah, I'm in this. This is evidence. I know I'm going to have ups and downs, but at least I know I'm going through the process and I've got something to back it up. When we look at the hormones that we typically draw, it's something around estrogen, estradiol, progesterone, then LH and FSH. There are some docs who are smarter than me that have a more focused panel, but then I'll also do thyroid testing just to make sure your thyroid isn't off, as that's a hormone that can cause problems around this time, as well then as testosterone. And so for some people, there are some docs, older docs, myself, we didn't grow up with or get educated on testosterone use in women and how do you actually do a good job with putting people on testosterone, taking them off, what are the symptoms, side effects they should know or understand. So hopefully there's a newer generation of docs who know a lot more about that, and it's easy for us to learn. But again, does your doc know everything about how to give you those hormones or what to test for at least? So I think it gets to the point where you should advocate for yourself when you don't feel like you're making any progress on symptoms or you want a firm diagnosis. I think it's your damn blood. Hopefully you have a provider who will work with you on that. I think if it gets out of hand and your symptoms aren't being addressed or you're not being able to make any progress, for sure that's the time. But certainly at an annual physical, you can get many of these labs drawn if you have access to a doc and you've got that benefit. I think it's thinking about the opportunities when you're seeing a doc, whether or not you're OBGYN or a primary care doc, but trying to say, look, I really want these labs. I want to see what they look like. I want to compare them to what they were previously, or just have a baseline. So then you can say, yeah, this is where I'm at, and then hopefully make some change if anything's off.
I mean, first of all, we're extremely lucky to have you on our board, and we're so grateful that you're spending time with us and helping educate us as well as other women out there, kind of taking a look at. I think we're kind of on the precipice of, really changing things and want to build this community for women to be empowered, to have education, and to really feel connected, right? Like we all don't know what's going on with our bodies. We want to have a good idea. We want to feel like we have friends that we can talk to and doctors who are kind of behind the scenes who are helping guide what we talk about and the information that we share. Just kind of summarizing our entire conversation today, like what do you look at and how do you feel about the future of healthcare for menopausal women? Future's wide open. We're leveraging AI. We're starting, there's telehealth out there. We're starting to do in-home blood work. So just kind of talk a little bit about like why you're excited about the future of menopause and where things are going for you. For us.
Yeah, for me,
For us.
I think I'm incredibly excited about it because there's finally a recognition of this group of women who are not having a serious health issue addressed. And so there's going to be a lot more money. There's going to be a lot more work around this, and being able to actually address it in a way that's going to be practical for people is wonderful. So on the medical side and the research side, that will still always be behind, and the research that we need to do will be slow. But the advent of AI, that when we actually have those studies and when we look back, the advent of AI with the internet, that can then accelerate everything and make up the difference of some of the difference or most of the difference in what women are able to access in terms of information or understanding, and then at least hopefully treatments that they can do on their own to really help and understand their bodies better to get to the point where they feel better. So that piece to me is incredibly exciting because you don't have to wait again on someone else. You're able to do it yourself and you're able to go forward. So I think I just read something on, gosh, I think they're trying to set up a center of excellence for menopause. I think it was six senators and 40 some representatives that
Hopefully they're not male senators and male representatives.
No, they're all female. They're all
Good.
female. They're all female. But that's the problem. When you have dudes overseeing women's health, that's all.
Dudes who don't have vaginas. I mean,
yeah.
Yes. Well said. So that's a giant issue. I think I read something where they're going to pour $275 million into the Center of Excellence for Menopause so that they can have more research just dedicated to it, and then have to report that out to any number of government officials. So for me, when you have that legitimacy at the federal level where you're having money truly pointed at menopause research, fantastic. So hopefully that piece will get a better foundation, but then that AI piece can really bridge the gap on a lot of the things that women are going through.
It's about damn time, isn't it? Lizzo, who had that song. Yeah. It's about damn time.
Yeah. We're gonna close the episode with that song.
I have one more question for you, Ozzy. To
Sure.
all of our husbands and partners and brothers and fathers and male figures that we have in our lives, aside from running like hell, drinking copious amounts of tequila, getting a second home to escape the menopausal women that they might have in their household, as a man who has a daughter and has a significant other, what's your advice for a man to support someone he loves going through menopause?
Oh, the first step is listening. Listen. But it's true. You got to listen and hear what they say without trying to find a solution or find an answer. So it's just sitting and listening to all that's going on. And then it's learning. It's just learning basic things about what's happening. I saw a really funny TikTok. Unfortunately, I love TikTok. Saw a really funny TikTok where this guy was in therapy with his wife. And the wife said, "You're just not hearing me. You're just not listening to what I'm saying. And that makes me feel really bad." And so the guy said, "I don't know what you're talking about." And the therapist put it in golf terms. And then he knew
Oh,
exactly
that's funny.
what was going on. Oh, it was brilliantly done. But it's that piece of what's going to really resonate with a guy from an information standpoint. Maybe you have an offshoot of Hot Flash Health,
For
Menopause for
dudes.
Dummies,
For
for yeah,
dudes.
that help dummy men figure out how to best support women going through this. I've never had a hot flash. Every woman I know my age has. And so I just look at them and I'm like, oh man, I'm sorry about that. So I think we don't know what a woman's body goes through, obviously. And so that puts us behind the track on being able to empathize or sympathize with what's going on. So I think it's a lot of this is education, listening from a guy's standpoint, and then education from them and getting them to read or at least understand what you guys are going through in a way that's going to be helpful for them. And everyone works differently, everyone's brain works differently. Sometimes it's yelling at the person and saying, "This is how I'm feeling. This is what's going on. Don't mess with me." Other times it's, "Here's a website. Go to AI." It'd be really funny to look at AI and ask, what should dudes know
Yeah,
about menopause?
yeah, we'll have to do that.
Yeah, we'll do that.
I'm pretty sure you dudes don't know about lack of libido. I mean,
Yeah.
that's a sure guarantee. And if you dudes were smart, you guys would be researching the hell out of testosterone because apparently, rumor has it, is it increases your sex drive off the hooks, and your wife would be humping you like crazy. So
Yeah.
come on, guys.
It's a simple equation. It's thinking about others first. It's thinking about what your partner or what the women in your life are going through and then being really able to support them. And that testosterone piece, boy, I'm telling you, there's so many women who are getting testosterone now that is really helping any number of different symptoms, especially as they're going through perimenopause
Yeah.
or menopause.
Sign me up.
Yep. You're awesome, Ozzy. Dr.
thank you so
Grenardo.
much.
Dr. Ozzy Grenardo, Medical Director of Hot Flash Health.
Yeah. Thank you again for being here, being a part of this journey with all of us. That's a wrap on today's episode. Remember, menopause may be a wild ride, but together we've got this. Don't forget to follow us on Instagram and Facebook at Hot Flash Health. You can also stream and subscribe to our podcast on YouTube and Spotify. So share your thoughts with us anytime. We love hearing from our fabulous listeners. Until next time, stay fabulous, stay sassy, and keep those hot flashes in check.